Well, there's only really 3 ways to know that you've ovulated. And those 3 ways are if you're pregnant, you go back 2 weeks and you're sure that you ovulated, or in the middle of a cycle if you're doing a pelvic laparoscopy and we're inside in surgery and happen to see it, or number 3, which is the most common, is ultrasound. So you need to ultrasound just before in the middle of your cycle and see, did you actually develop a follicle to the right size? Did it reach a Graafian follicle, the single follicle, the Graafian follicle, or the lead follicle? Did it reach the right size? And 2 to 3 days later, recheck it, see if it's collapsed and fluid has come out, then you're certain that you've ovulated. Really, that's really the only way to know. We can determine if there's, in the last 2 weeks of a menstrual cycle, if we're seeing a corpus luteal cyst, it has a characteristic appearance. And that corpus luteal cyst is how we can also tell we're pretty reassured that the person did ovulate, that it's not an anovulatory cyst. Anything else really is not very predictive. An ovulation prediction kit that you can buy, it's a kit, you check your urine every day. That shows that the brain thinks that it's the right time for an LH surge, and the LH surge should predate the ovulation, maybe by 24 hours, 36 or 42 hours. But there's a lot of times where people haven't even developed a follicle enough to surge, but the brain thinks it's the right timing, so then it will give you a surge, but they didn't ovulate. Other ways, basal body temperature charts are used a lot. That really only indicates thyroid levels and progesterone levels, but it doesn't mean that you've actually released an egg. And serum progesterone levels, day 20, 21, 22 of a cycle, don't mean anything either, because people can run through, develop the follicles, not fully mature it, not release an egg, but it converts and makes various amounts of estrogen and progesterone, and yet, you know, they may not have ovulated at all or actually released an egg. And individuals that have progesterone levels and they're pregnant may have a progesterone level of less than 2 and it's probably an ectopic pregnancy, or less than 8 and it's going to miscarry. So those are well outside of the normal parameters for ovulation. So that doesn't tell you that you've ovulated either. Regular menstrual cycles don't tell you. Thin clear mucus in the middle of your cycle doesn't tell you, because I can give you estrogen at any point in the cycle and you make thin clear mucus. So there's really no other test other than ultrasound that is accurate enough to determine that you're actually ovulated that cycle.